Well, a new health alert today, and it's taking a closer look at eating disorders and just how prevalent they are here in this country. The study says that someone dies from an eating disorder every 52 minutes. On top of that, less than half the people who are diagnosed are given treatment for their disorder. And if you think you know the signs, doctors say more than 90% of people who have an eating disorder are of normal weight or perhaps even overweight. So we want to bring in Dr. Sona Dave, who is an eating disorder specialist, to talk much more about this. Doctor, thanks so much for joining us this afternoon.
Thank you for having me.
Obviously, this is a very disturbing study. It makes mention as well that there are new demographics that are now being diagnosed. So who are these people who are suffering now?
Yeah, so I think it's important to just know that eating disorders affect all races, all genders, all body shapes and sizes. There's not a distinct weight where someone's going to be diagnosed with an eating disorder. It's really an emotional relationship with food or with their body that really gives someone an eating disorder diagnosis. So I think it's important for people to identify that it's not often what we think when we hear the word eating disorder. It's often very different than that.
So let's talk a little bit more about that, because I think most people, when they think about an eating disorder, they think of someone who is starving themselves and looking very gaunt and underweight. But the study points out that most people who are now suffering from eating disorders are actually of normal weight.
Yeah, so I think what it's pointing out is that some patients with eating disorders, for example, they may start out at a higher weight and then lose weight in an unhealthy way and in a disordered way, but they are still normal weight when someone just looks at them per, their, like when you compare it to their height. And because of that, they may get the incorrect idea that, oh, this weight loss was fine. Well, in reality, it's actually really dangerous and unhealthy for that amount of weight loss. So I think it's important that if you are concerned that someone has an eating disorder, for especially parents, to just ask questions like, why are we engaging in this exercise regimen? Why are we joining this sport? Why are we eating differently than we were a year ago? And I think having the answers to those questions can cue you into if someone's having this abnormal relationship with food.
So for parents who are listening to this conversation, what are some of the warning signs that they should perhaps pay closer attention to that they perhaps maybe thought was just normal behavior?
Yeah, so I think, what's important to know is that in your teenage years, you're supposed to be getting more nutrition than any other time of your life. So if you see your child starting to decrease the amount of nutrition they're taking in, or pick up a new exercise regimen or sport or something like that, and not adding what they're eating, that's all kind of red flags. So I think parents should look out for that specifically.
Okay, all right. Dr. Dave, we really appreciate you having this conversation with us. A very important study coming out today about eating disorders. Thanks so much for your time.
Thank you.